All right. So, hello, everyone, and welcome. My name is Marche Jones, and I'm the Director of Operations for CCPU. Thank you all for joining us today for this brief but important informational session about the Provider Assistance Program, also known as PAP, brought to you in partnership with Spring Health. We're excited to share that this new mental health benefit and wellness benefit is now available at no cost to approved providers of the CCPU Healthcare Fund and their eligible dependents. If you are not quite yet enrolled in the fund, you can still apply. And once you're approved, this benefit will be available to you too, completely free. This program is here to support you, our state's dedicated childcare providers, by offering access to therapy, self care tools, and emotional support resources through Spring Health. I'd also like to introduce Courtney from Spring Health, who will walk us through today's presentation. Before we begin, I just want to give you a few quick housekeeping items. Um, Please remain muted at all times during the presentation. If we're taking questions at the end, we'll ask you to come off mute. We will not be taking provider specific questions today. The session is being recorded for your provider friends who were unable to join us today. So we want to protect your privacy and avoid sharing sensitive information on the web. And then lastly, we will, of course, have time at the end for a few general questions. So you can feel free to throw them in the chat. We'll try to answer them if we can as the presentation goes along. But rest assured that if you ask a question that we aren't able to answer in the chat, we will have time at the end for your questions. So thank you all again for being here. And now I will turn it over to Courtney.
Hi, everyone. Thank you for having me. I'm going to quickly share my screen. Marche, let me know if you can see it.
I can.
Perfect. So I really appreciate everyone's time today and coming on a Saturday to learn more about Spring Health. As Marche mentioned, the CCPU Healthcare Fund has partnered with Spring Health to give you and your family members the tools and support that you need to be well, not just in moments of crisis, but in your everyday lives. Today's session will help you understand how Spring Health works, what's included in your mental health benefit, and how to access those resources. Again, as Marche said, today's session is set up as a webinar, so your camera and audio are turned off. So please just sit back and relax, and we'll take some questions at the end of the presentation. And I'm joined here with Leonardo as well to help us translate and answer any questions. So, introducing Spring Health. Spring Health is a new benefit through the CCPU Healthcare Fund that offers convenient, personalized mental health support. Our online platform, telephonic platform, so you can also call in via phone, is easy to use. It's built on science to ensure you and your family get the right care at the right time. No matter what challenges you're facing, we'll be your partner every single step of the way. And we
Colaboradores
always like
cada
to
paso del
start every
camino. Y nos gusta
conversation with the
empezar toda
presentation that we
conversación o
have with our
presentación que
mission
tenemos
statement.
con
I
nuestra
know
declaración de
that
misión.
all of you
Yo
childcare
sé que
providers
todos
that are
ustedes, proveedores de
members of the
cuidado, que
CCPU
son
Healthcare
miembros de
Fund, are
este
very
CPU,
mission-driven
de este fondo,
individuals. And
son
so our
personas con
mission
una
at Spring
misión y
Health is to
nuestra
help
misión Spring
individuals
Health
like
es ayudar a
yourselves
los
and
individuos como
organizations
ustedes,
thrive
de
by
organizaciones,
eliminating
para
one
que
single barrier to mental
avancen para
health.
eliminar cualquier
Some of
barrera
the
que
most
tenga la salud
common
mental.
barriers we hear
Las
include
cuestiones más comunes que
stigma,
encontramos son
access,
estigmas, acceso,
financial barriers because therapy
barreras
can be extremely
financieras,
expensive.
porque esto
Some
puede ser muy
examples
caro.
of this
Unos
might be
ejemplos de esto
you want to try out
es que
therapy, but you
ustedes
don't know
quieren
where to
tratar
begin
terapia,
or you
pero
don't
no
know what
saben
to
dónde empezar,
expect.
no saben
And
qué
so you don't
esperar
follow through with
y no
asking for
dan
help or
seguimiento
trying
haciendo,
to
pidiendo
seek help because
ayuda,
that task
tratando de
alone is
buscar ayuda, porque
extremely
esto
overwhelming.
es
Or
extremadamente
perhaps you
abrumante.
see a
O a lo mejor
therapist and that
ustedes ven
therapist isn't
terapista y ese
taking new
terapista
patients,
mm,
has a very long waiting list, or doesn't have appointments that fit in your busy schedule. Or maybe you finally found the right therapist, but the cost of care is extremely expensive, so you can't afford to continue care. Or maybe you aren't sure if therapy is even the right solution for you and you want to understand your options and try something different. And that's where Spring Health will step in. We have you covered in all of these areas and many, many more. So, how can Spring Health help and what is it? Here is a general high-level overview of the benefits that are already available to you if you are an enrolled member of the CCPU Healthcare Fund. We launched Spring Health on July 1st, so this benefit is officially live and, as Marche said, completely free to those who are enrolled in the Healthcare Fund and their eligible dependents. We'll go into more detail about all of these services in the next couple of slides, but as you can see, your mental health benefit is going to include much more than just therapy. So for therapy to work, this is where we're going to start our conversation today. It needs to work for you, and that's why Spring Health offers flexible care that fits your individual unique needs and your preferences and your schedule. You'll have easy access to therapists who speak your language and are available to support you within a few days. It's extremely important to engage in therapy in the language that you're most comfortable with, especially during such a vulnerable time. So, we're able to actually offer you over 100 different languages. So, our therapists and coaches on our platform speak over 100 different languages fluently. We make sure that you can find experienced therapists that make you feel comfortable, and we pride ourselves on offering the most diverse provider network out there in mental health care. And we're continually expanding and monitoring our network to make sure we have the best possible outcomes for every single provider that engages in care on Spring Health. So, just at a glance, our provider network has over 51% of our providers identifying as BIPOC. Our providers speak over 100 different languages fluently. We have over 25 different unique treatment modalities, and 75% of our providers specialize in LGBTQ plus specialties as well. So, at Spring Health, we'll talk a little bit about coaching too. So, coaching can help you unlock your potential and reach your personal or professional goals. Coaching can be complementary, independent of, or an introductory step to therapy. And while it's not a substitute for therapy, it can absolutely help you improve your life. A specialized coach is available to work with you to build a realistic plan to develop new skills, build healthier habits, and achieve any of the goals that you have in mind for yourself. They'll act as an accountability partner and provide unbiased guidance and encouragement and support towards your goals and progress. Spring Health's diverse network of certified coaches cover more than 35 different specialties, 20 different languages, so that you can find the right coach for you. And coaching can help you create your path to success in professional and personal development, health and wellness, parenting, you name it, we have a coach that can help you. Now, I wanted to talk about an advancement in the Spring Health platform that I think is really awesome. So, we know that when it comes to mental health, it's not about just therapy, but it's about the everyday challenges people are facing. Things like food insecurity, housing, financial stress. All of these things have a massive impact on your well being and on your state of mental health. And that's why Spring Health, in the platform, we're actually able to connect you to real local resources that can help with these issues. I'm actually going to take you through a live assessment to show you what it looks like to get signed up with Spring Health. But we'll actually ask you providers if there's any struggle with accessing food, paying your utility bills, access to stable housing, you name it. And if you select any of these options at all, we'll actually be able to connect you to over 500,000 locally vetted community resources in the Spring Health platform directly. And we have people that can actually assist you, and they're called our care navigators. They can actually connect you to these local resources and benefits as well. And it's not just self-service. So you really do have a care navigator like Gabrielle. Gabrielle's actually a real care navigator on our platform. She speaks Spanish and English, and she can help you and give you support that you need. Something that I think is interesting is since we've rolled out this advancement in the Spring Health platform, over 47%, this number 45 has jumped up to 47% now of our members are actually flagging for needing help with one of these social determinants of health. So it's extremely important and something we're very, very proud of. Another advancement that we have in the Spring Health platform is our Moments library. So you can think of Moments as short, self-guided digital wellness exercises that provide immediate relief, and they help you strengthen your well-being over time. There's over 1,000 multi-format exercises to support many different areas of your life. So think personal growth, relationships, parenting, mindfulness, sleep, stress, anxiety, and many, many more. And these are based in cognitive behavioral therapy, and they're actually based in evidence-based techniques, and they've been proven to be effective in many, many clinical trials. So I use Moments, for example, before a stressful day at work, or for a provider, if you're going into a long and stressful day of caring for children, maybe taking a second to yourself and grounding yourself in a Moments exercise could be helpful. And all of these exercises, like I mentioned, there's over 1,000 different exercises we're constantly adding to our library. They're available in English, Spanish, and 7 other languages as well. So again, you can indulge in these short bite-sized exercises in whatever language you're most comfortable with. Now we are going to talk a little bit more about the details of the benefit offered to the CCPU Healthcare Fund members. So we know how important confidentiality is, and we want you to feel comfortable when you're seeking support through Spring Health. So if you're wondering if the CCPU Healthcare Fund will know about your care, the answer is no. Your care with Spring Health is private and it's confidential, and we take our responsibility to protect your privacy very seriously, and we do not share individual data with with the healthcare fund unless you were to request so. Your assessment answers that you screen for in the assessment are only used to help recommend a therapist or a coach for you. Everything is HIPAA compliant and extremely, extremely safe. So we want you to realize how safe and protected you can feel with Spring Health. And
Courtney,
yes.
sorry to interrupt. Can you slow down just a little bit?
Oh, yes, sure. So now going to activating your account online. You and your eligible dependents, as Marche mentioned, can get started by visiting the ccpuhealth.springhealth.com. And as I mentioned, this benefit is live as of July 1st. And I'm going to click this link just to show you what this looks like. And so as you can see, the biggest call to action on the screen is to create your account. So you'll click create your account. Again, I'm going to show you this a little bit later on in the presentation, but one thing I wanted to call out is how easy it is to trade your language. So whichever language you prefer, I can click over to Spanish very, very easily, or I can search. I saw in the chat questions around Arabic, for example. You could search and select Arabic as your language, and then every time you come to the Spring Health website, it'll be in Spanish or Arabic or English, whatever language you prefer. And pausing here just so you can see this slide in Spanish as well. Awesome. You can also access Spring Health via the app from the mobile store on your iPhone or Android. It's completely free and allows you to be able to do your care on the go and manage your appointments that way as well. Spring Health is also available by phone too, so I'll share a little more about that. Activating your account by phone. So you and your eligible dependents, once again, can call in to this number here. This is actually a CCPU specific phone line. So I recommend saving this number. We'll also post it on the website, but this number is just for CCPU providers to call into. And again, you can request to speak in English, Spanish, whatever language you prefer. And all of the services that we'll be talking about today are available via the phone as well, if you prefer. So getting started with Spring Health is extremely easy. It takes a few minutes to set up your account and access your benefits. First, you will activate your account online and you'll take a quick short assessment to identify your needs and your goals. And then we'll give you a personalized care plan and some therapist and coach recommendations. And after that, you'll have full access to what Spring Health has to offer completely for free. CCPU providers are eligible for 6 free therapy sessions and 6 free coaching sessions. And I wanted to call out that your eligible dependents, if you choose to invite your dependents to this benefit, they will also get their own 12 visits for free. So you each get 12 free visits. So something I really want to emphasize is by inviting a dependent, it does not take away from your visits. They will get their own set of 12 visits, which is again live right now. So So after you click the Create My Account button that we just saw, you'll be prompted to enter your email that you have on file with CCPU. You'll enter your name, your date of birth, your preferred email address, and a password. If you prefer a different email address than the one you provided to CCPU. And this will be the email address and password that you use to log into your account and where you will receive all of the notifications and correspondences about your care. We recommend using whatever personal email you prefer to keep your Spring Health emails private and separate. And as I mentioned too, available to your dependents, you can easily invite them with a click of a button, and I'll show you that in just a moment. So we know that every single person is different, and that's why we take the approach to personalize your care. Once your account has been set up, you'll be directed to our confidential mental well-being assessment. It only takes about 2 to 3 minutes to complete, and the questions help us understand what type of care you may need. The assessment screens for over 12 different mental health conditions. It includes things like depression, anxiety, ADHD, PTSD, and many more mental health conditions that it will screen for. And it's dynamic in nature. So each time you check in, it's going to learn and change and ask you new questions based on your responses. It's important to be as honest as possible while taking the assessment. Your input helps us understand more about you, what you're dealing with, and how you're feeling. Again, if you don't feel comfortable completing the assessment, you absolutely do not have to, but we recommend it as it serves as a nice, easy way to get into care and have the assessment make some recommendations for you on who to meet with. And now I'm actually going to show you this assessment live and how easy it is. So as you can see, I clicked the Create My Account button. I went ahead and added in my personal information, my name, my address, email. And now I wanted to show you how easy it is to invite a dependent. You can invite an adult dependent. So if you have a eligible dependent that's over 18, you would click this link, or you can add a child. And the first question that Spring Health asks for is for you to set some goals. No need to set goals if you don't want to, but for the sake of today, I'm going to say I want to feel happier. Then it's going to ask me what challenges can Spring Health help me with. I'm going to click today that I'm feeling sad, down, and depressed, but you can absolutely click all of these, none of these, whatever applies to you. It's going to ask me some other challenges that I'm looking to work on. Maybe my relationship with alcohol. Maybe I am trying to quit smoking. Maybe I'm having panic attacks. Whatever it may be, again, I'm going to select what applies to me. And as I mentioned, Spring Health can help connect you to local resources to assist with accessing food, stable housing, paying your utility bills, whatever it may be. So I'll go ahead and select those 3 things that I need help with today. And then it asks, how does your mental health impact your productivity at work? Maybe it impacts me by 2 days a week. I feel less productive at work because of my mental health state. And then it'll ask me, did my physical or mental health issues cause me to miss any days of work? And again, we encourage you to be extremely honest here. And again, I'm going to click through the assessment as easily as this. And I wanted to pause at this question. Spring Health takes the responsibility of screening for suicidal ideation. It's extremely important for us, since we provide mental health resources. We need to make sure that we're asking this question because we want to make sure that we're helping those individuals in that time of crisis. If I selected anything besides not at all, we would actually immediately have one of our care navigators reach out and get that member into care. The assessment's extremely easy. I'm all done. Again, I can access this assessment if I call into that CCPU phone number, and I can take the assessment that way as well as in any language that I prefer. And now I'm live in the Spring Health platform. So it's very easy. And as you can see, it's recommending I start with coaching. but I wanted to quickly show you how easy it is to browse for therapists. So I can come in and browse for therapy. As you can see, an appointment is available Saturday, July 12th. But let's say, for example, that I'm interested in seeing a therapist in person. So I can go ahead and update my results. It will show me how far away the therapist is from me, and I can go ahead and book this appointment as easy as that. So I'll be able to get into a care appointment with Malia on Saturday. Now we'll go back to the presentation. So as I mentioned, you can browse all of our therapists to find someone that you feel most comfortable talking to. We have filters for specialties, conditions, gender, ethnicity, language, whether you prefer in-person therapy, virtual therapy, and Spring Health offers all, like I said, all of these different specialties with providers, for our providers, the CCPU providers, in person. So I know for myself, I very much prefer an in-person therapy session. So we want to underscore that these 6 sessions are completely free. You have 6 therapy and 6 coaching sessions available to use. And since we launched the benefit July 1st, I encourage you to use your 12 visits now because you're going to get another 12 visits handed to you January 1st of 2026. The sessions do not roll over into the next year, so you have to use it or you lose those sessions. So now to talk a little bit more about support specifically on the Spring Health platform. So as I mentioned, our platform is available in English, Spanish, Arabic, and over 100 different languages, including languages like Portuguese, Hebrew, German, Mandarin, you name it. And as I mentioned, in the upper right-hand corner of the screen, you can easily toggle to whatever preferred language you would like to engage in care with. Spring Health also offers 24/7, 7 days a week, 365 days a year crisis support. And our crisis support is available whenever you may need assistance, life-threatening or not. And we hope that you never have to use this number, but if you do feel like you need to speak with someone and cannot wait to book a care appointment, you can call into the crisis line and press number 2. And in under 30 seconds, a licensed master's level clinician will answer your phone call and will be able to help you and assist you with any immediate care you may need. Our care team is available by phone if you have any questions or need any help with the Spring Health platform. They're available Monday through Friday. As I mentioned, our 24/7 crisis line is separate from this care team. So this care team is to ask any questions or if you need any help with anything, you can call into this number. Also, this is why we established a CCPU specific phone number that you can call into, and that care team is versed in the CCPU offering, and they'll be able to help you even further. We also let them know to have different languages, so if you prefer to have that phone call in English or Spanish, they'll be able to assist. That's all I have for you today. I know I talked a lot, so I'm happy to stay on and answer any questions you may have. As Marche mentioned, this was recorded, and we will be sending you some materials in the mail as well soon to help you get signed up.
All right, do we have any questions or are there any in the chat, Lily or Marcella, that we would like to address with the broader group?
There are no questions in the chat, but you're more than welcome to ask. No hay preguntas, pero si tienen alguna pregunta pueden hacerla con confianza, por favor.
Well, Courtney, I think you must have done a great job because there are no questions coming through.
Wow, that's amazing.
All right. Well, we don't want to hold everybody on a wonderful Saturday. Thank you all for joining. The webinar will be posted and available for future reference. We'll send out a communication letting you know where to go to get it. And again, we don't want to hold anybody on a Saturday. Thank you all for joining us, and we will see you next time.
Thank you, everyone.